Greetings of peace. I am here to tell you about what to expect on your first EMDR session. Now, there is a difference between the first EMDR session and your first session. So when you seek a EMDR therapist, when you seek out an EMDR therapist, don't expect that your first session is gonna be straight into the trauma healing and EMDR. That is not how it works. The first session is always an assessment session, and in fact, it could be several sessions of assessment before we begin doing the EMDR work. Now, I know that many of you are eager to actually get to the EMDR part, and that is very exciting and important. And it's also really important to know and to understand that there is a lot happening between the therapist and the client. And when you come into my office and you are getting to know me for the first time, you have never met me, you've seen me perhaps on these videos, you have seen me online, you might have known about me in the community, or somebody might have told you that Mussarat is a really great therapist, you're going to be in amazing hands if you go to her. You might have heard all of those things, and that does help to build a sense of safety and trust between you and I. However, when you are first coming into my office, and that office could be my virtual office or it could be my office right here in this space, when you are first coming and we are meeting each other, our brains are learning to get to know each other. Our brains are finding ways to build safety. So in the first session, what is happening is I am getting to know you. I am giving you space to know me, to ask your questions, whether they're logistical questions, whether they're questions about EMDR. You might ask again what EMDR is. And each time I have a little different version of what EMDR is. And so when we begin to talk and you understand my style, my approach, you hear my voice, you see me, you get a sense of me, your brain is starting to build trust and safety, which are really important things to have before you do the EMDR work. And this is why you can't do this alone. You want to do it with a safe person who has been trained in EMDR. And over the first session, I will begin to ask you questions. I will get to know you. I will get to ask you some historical questions. Now in that, there is going to be lots of vulnerable information that I'm going to be asking you for. And so that also takes time, and I will be pacing it according to the information that I am getting from your verbal and nonverbal cues. I'll be checking in with you about how all of this is feeling and if it's comfortable. And so you might be comfortable to give me a little bit of information. And then in the next session, you might give me a little bit more information. And then in the next session, you might feel comfortable giving me a little bit more information. Some of you might give me all of your information really quickly all at once. Every person is different. Every nervous system is different. And I have been trained and I have experience working with many kinds of nervous systems. And this is what I am good at doing, which is I am able to be with different kinds of people with different nervous systems, and each person is unique and different. So though I may ask many of the similar questions to each one of you, but you are going to be a unique person to me, and I am going to be asking you the questions in a different way that I would ask another person, or I am going to be pacing the session differently according to your needs and according to your nervous system. We will also be creating a dynamic between you and I. Your nervous system and my nervous system will be syncing in with each other. And so I will be hopefully a secure anchor for you so that you can express all of your emotions in a safe and trusting environment. So the first few sessions, you're getting to know me, by, you asking me questions or me giving you information. I am getting to know you by the information that you're giving me, and we're talking about your life, what got you here and now, things like that. And then what I like to do after I have done a little bit of history taking, and this might be in the second or third session, I like to build your resources for creating some kind of soothing when you are distressed. So in the second or third session, I will begin to bring in some exercises and give you some tools and teach you some tools. And then after I have given you those tools, then I will, in the third or fourth or maybe fifth session, then I'm going to do something that's called taking a timeline. So that is the next step of the EMDR process, which is where I sit down and we go through a little bit more thoroughly than what we did in the initial sessions, is we write down particular memories that are disturbing for you. And I do this in different ways for different people. So one way is we go through, let's say you're a 40-year-old, and so we go through age 0 to 7, 7 to 14, 14 all the way till end of high school, 18, and then college, let's say 18 to 22. And then let's say you did a, master's, or you're in medical school, whatever, so 22 to whatever, 32, right? Whatever, and then, so going until age 40, we write down all those memories. Now, don't freak out if you're thinking, oh my God, that's a ton of memories. There are ways that we figure things out. This is just one way, right? It could be that you're 18 and, you have much less of traumatic events happening than, let's say, somebody who has been 40 years old and has been carrying that for 22 more years, right? So another technique is that I begin with one stage of life. And so I like to begin, most naturally with the earliest years of childhood. However, sometimes we start with the latter part of life. And so again, because of my training, I have many ways to go about in how to know where to start and where to begin. So then you will be at your fourth or fifth session. And that's when I will begin the first EMDR session. Remember that we've been doing EMDR all along because this is all important of building safety and trust with your brain, with my brain, with my nervous system, with your nervous system, getting us comfortable with each other. And then by that fourth or fifth session, your nervous system is a little bit more ready to work on the actual memories. Now, I like to begin with a memory that is, let's say, milder than a memory that might be more heated. And one of the terms that we use is, what is your level of disturbance? 10 being the highest and 0 being neutral. So if a memory is at a 10, I'm not going to start with that memory in my first session. I'm going to do that later. In the first session, I'm going to do a memory that's less than 5 so that you get a sense of how it feels and how it works and what it feels like. Once you've had a little taste of what that EMDR memory work looks like, and we might do a few of these so that you really get a sense of how it is. And again, every person is different, and this is why therapy is unique to you and your needs, and you are not, just one little checkbox in whatever, in my to-do list or anything like that. And so uniquely, I look at your needs, how this is sitting with your nervous system. And then we then slowly begin to work on the timeline that you and I together have come up with. And after this, we are getting into the memories, we're working through the memories. So there you have it. That's what several of the first sessions of EMDR look like. In the next video, we will talk a little bit more about, the middle of EMDR and more things related to EMDR. Have a great and amazing rest of the day. Greetings of peace and salutations of peace upon you.